So, moving on. So for today, I kind of just wanted to talk a little bit about a question that's been posed by a couple of patients, uh, really just talking about how to best improve their gut microbiome, and specifically in terms of reducing yeast overgrowth. So I had one patient that basically came to me, was complaining of sugar cravings, meant brain fog, GI distress, and had read that, maybe some of the symptoms that he had were secondary to Candida overgrowth or yeast overgrowth in his GI tract. And so this is, something that's kind of interesting. It's pretty popular. People are like, oh, well, leaky gut syndrome. What exactly is that? So I kind of, wanted to talk about a couple of points in regards to that. So I'm going to share my screen here. And so again, the individual was asking about Candida, which again is a yeast that's normally found within the gut, the skin, the mucous membranes. Within certain concentrations, it's completely normal. We really just tend to have the problem when there's an overgrowth of this particular microorganism in comparison to other bacteria. The helpful bacteria in our GI tract, the main ones, lactobacillus, bifidum, bacterium, along with Saccharomyces. These are all pretty common and helpful
Women get this?
microbiome.
It sounds like a one. Sorry, I don't mean to interrupt, but this is kind of like a an infection that women get.
Oh, Candida? Yeah, it is.
Yeah.
Yeah, yeast. It is a yeast infection. Yeah, it's
So
when
guys can get
women
it as
get
well.
yeast infection. Yeah,
Okay.
absolutely, absolutely. Yeah. Uh, with guys, oftentimes you can see with athlete's foot, you can see a white coating on their tongue. Oftentimes, acne and eczema can be related to Candida too. So it is kind of interesting. And what I wasn't aware of is it can lead to autoimmune illnesses too, like rheumatoid. Sometimes Candida can be linked to that. So again, when we're looking for what it causes, though, some of the symptoms you might see, sugar cravings are a big thing. So if you're one of those individuals that you just cannot control your sugar cravings, you just have to, you love refined sugars, and it's just really hard, and you want a diet, they're bad for you, but you get these cravings that may be secondary to Candida overgrowth, right? Brain fog, poor memory, anxiety, and depression. Well, these are pretty generalized symptoms, but Canada can be linked to that for sure. So, you know, improving this would definitely be helpful if that is a concern of yours. And then the more classic symptoms that we see clinically are like a white coating on your tongue, which is just secondary to yeast overgrowth. In women, vaginal infections, UTIs are more common in women, secondary to Candida. Athlete's foot, acne can be secondary to Candida. And so these are all things that you may see physically as well. So what causes it? Well, a weakened immune system. So in my other life, I work as a pediatric cardiac anesthesiologist. We work with heart transplant patients. And a lot of these patients tend to have a weakened immune system owing to the immunosuppressive medications we put them on because the tissues from a donor, right? And the problem with that, though, is when you suppress your immune system, you have to watch out for other bacteria that are going to, cause get overgrowth. So we'll put these patients on particular antifungals. Like nystatin is an antifungal agent, a agent that kills yeast, right? And we'll put them on that so that they won't have candidiasis. But if you have a weakened immune system, and your vitamin D levels are low, maybe your hormones are not optimized, and you're not eating appropriately, yeah, you could be more likely to get Candida overgrowth. High sugar diet. Yeast loves sugar. So if you're eating lots of carbohydrates, processed carbs, you're definitely gonna cause it. Antibiotic use. We all are susceptible to times. We might have an upper respiratory infection, UTI, bronchitis, even acne. A lot of us are taking doxycycline for acne, right? What we don't realize is when you take oral antibiotics, you kill off good bacteria. You kill off good bacteria. Lactobacillus, bifidobacterium, Saccharomyces, Lactobacillus and bifidobacterium primarily. And you run the risk of Candida just growing and growing and growing. So you got to watch out for that. And again, more for women, oral contraceptives are definitely associated with Candida overgrowth. And then there's stress. If you're stressed out, it's a problem. So, go ahead. Or
No, yeah. I mean, so basically how you like diagnose it is it's like multifaceted, right? No, you're saying
yeah.
that there's still
So
tests.
yeah, the main way, so typically I will diagnose my symptoms and then just go ahead and proceed to therapy because that's typically the easiest way to go around it, and it seems to work well. However, you can do a stool test, right? And so when individuals get a stool test, they'll get something like this, which will kind of, they'll take a fecal sample and they'll send it off to a laboratory, and you'll get a reading that will kind of give you the amounts of certain bacteria, right? And if you see that, Candida is particularly high, it will result as high, right?
Right. Yeah.
Now, that's definitely possible. You can definitely do that. Another thing that you can look at is your CBC. So individuals, if they have a fairly lower white blood cell count, lower than I think it's like 4,000 per deciliter,
Right. Right. Yep.
uh, you will have that's indicative potentially of a candidal infection. Also, looking for elevated IgG, IgA, and IgM antibodies are also indicative of a candida infection. So those are some of the things that I'll look for. Now, again, if I have someone with these symptoms, I typically just go straight to the therapy, because the therapy is really the main thing that's going to improve it, and it will improve a lot of other things as well. So, number one, what is the most important thing, the key and most important thing you have to do? You have to starve the overgrowth. If you don't do this, the other things are not necessary. This is about like 70, maybe even 90% of your results. You have to starve the overgrowth, right? So, what does that mean? Smack the sack. So, don't eat any sugars, limit alcohol consumption, really look at carbohydrate consumption and reduce it.
So sugar,
Decrease.
alcohol, carbs. So like don't
Yeah.
okay. So no drinking or limit drinking. Cut the carb. Okay, sugar. Yeah, candy bars. Yeah.
Yeah. And if anyone's concerned, curious about this, there's a ton of studies that have looked at the influence of diet and Candida colonization. So this is one study that recently came out in 2019, and what they did was they looked at about several participants and looked at the Candida growth and compared it to their diets. And they found that individuals that had purified wheat flour products were linked to uh, or had increased consumption of purified wheat flour products had Candida in their gut at a higher concentration, whereas
White
those that go ahead,
purified
those that
wheat,
yeah,
wheat flour. It's white
were
bread. Like where's that come from? Okay.
yeah, exactly. In in the U.S., this I think was done in Poland, but I always try to avoid gluten containing carbohydrates or processed carbohydrates, but that I think is what they're referring to, processed carbohydrates, right? And what they did find was a higher consumption of cheese. So the individuals that tended to have less carbohydrates and had more fats in their diet tend to have less Candida cultures, less Candida growth in their gut. So that was kind of interesting. So again, trying to go towards a diet that is um, low gluten, low dairy, lower carbs, and that's the main thing. And when you do use carbs, use complex natural sources. Do not use ultra processed sources. Processed sources, again, ultra processed sources are sources that are several steps removed from their original source. So like French fries versus potato, right? French fries are ultra
Cereal, like
processed.
breakfast cereal.
Yeah, cereal versus like oats, right? So
Cornmeal.
um, corn on the cob versus cornflakes, right? Ultra processed cornflakes, right? So that's really key. Focusing on lean protein and healthy fats. Now, in that particular article, it talks about a higher fat diet was linked to less Candida uh, growth, and that's good. Now, I'm not a huge fan of saturated fats. I like to utilize healthier fats that are monounsaturated and polyunsaturated. So things like olive oil, sesame oil, macadamia nut oil, avocado, walnut oil. Some of my patients are like, well, aren't these, vegetable oils? Well, yes, they are, but remember, these are unprocessed. The types of oils that you want to stay away from are industrial processed seed oils, which are heated. They contain a lot of byproducts. They tend to have an overabundance of omega-6 versus omega-3. You know, everyone's like, oh, omega-6, omega-3, these are all essential fatty acids. These are good. Right. But if you have way too much omega-6 versus omega-3, linoleic, linoleic versus linolenic acid, that's not a good thing. That's actually linked to inflammation. You really want to have more omega-3 versus omega-6. And you find that with unprocessed olive oils that haven't been heated, right? Like extra virgin olive oil, sesame, macadamia nut, avocado, walnut oil, and even MCT oil, right?
Good, yeah. So we have to avoid the canola, corn. Yeah. So I heard horrific things about canola and soybean, rapeseed. Okay.
Exactly. Yeah.
Makes sense. Okay.
All right. So you do these things. Now remember, this is 80 to 90% of what you have to do. It's the hardest thing to do, but you got to do it. If you don't do this, the rest of it is not nearly as important. So, okay, then restore the good bacteria. Okay, so, you know, you're killing off the Candida, and over time, your good bacteria will grow. One thing you can do to help support that is to actually restore good bacteria. And you can do that, which again is lactobacillus, bifidobacterium, and Saccharomyces, right? And you can do this through probiotics. Now, people are like, well, what sort of probiotics should I get, Dr. Ryan? Well, there are a lot of them out there. I am a big fan of the liquid probiotics. American Health has one. Look for one that has at least 10 to 50 billion colony forming units per milliliter, right? And maybe I think I had it
here. We
here.
can put in the notes after if you need to.
American Health liquid probiotics. You can find these. Why do I like the liquid probiotics? They're easier to digest. There we go. So right here. They do need to be refrigerated. So this has 20 billion organisms per milliliter, right? And what you want to do is you basically want to take this with every meal for 1 to 2 months to help support the growth of those good bacteria cultures in your gut as you're healing, as you're getting better, as you're changing your diet, and that will help out a whole bunch, right? I'm more of a fan of the liquid refrigerated ones. They seem to be more effective than the capsule formulations. However, you know, having something, having any sort of probiotic is better than nothing, right? But try to, liquid's probably the best. Yeah.
So we'll do that.
Okay. And then there are some antifungals, right? So black walnut extract, caprylic acid found in coconut oil has been shown to actually reduce gastrointestinal colonization by Candida, Candida albicans, a particular form of Candida, and then grapefruit seed extract. So these are supplements that you can add on after you have made these two changes. And those three things ought to, within the span of 1 to 2 months, really radically change the gut flora or the microbiome, the atmosphere of your gut, right? The types of bacteria that are found within your gut. So all in all, you know, what I would suggest for patients that are worried about this, you know, reach out to me. In general, your diet, just like with a lot of things, your diet's going to lead to, it's so important for a lot of aspects of your health, but particularly for Candida. I think if honestly, just making the change away from processed carbs can be a huge difference, a huge game changer for a lot of people in terms of reducing Candida overgrowth. And then recognizing, hey, you know, once you do that, it will take 1 to 2 months. You may have a couple of situations where you kind of feel like you're not making progress or you're backtracking a little bit, but stay the course. And again, if you guys have any questions, or if any of my patients or you know, want some additional information on how to implement a plan to reduce Candida overgrowth, don't hesitate to reach out and, you know, send me an email and so on.
Yeah, I mean, gut detox is really popular. I see those questions a lot, and so we are testing out VIP as well, right? That's a intestinal peptide, right? That's active intestinal peptide. That's something that, you know, can support this as well. But we're looking at that as part of the pilot, Dr. Ryan. But yeah, I mean, I think this is super helpful. Gut detox and working on Candida, because it's more common than we think, actually. And so this is awesome to hear
Yeah.
some context on that.
Okay, well, that was kind of what I was gonna talk about this time. I think